Hi everyone, welcome back. This is the second PowerPoint for autism. If you're watching these videos on the days, then this is the third video for the first lecture day. We finished up the first PowerPoint, so we're going to just start this one today. So in this PowerPoint, we're going to be talking about neurobiology and the connectivity hypothesis of autism. So the connectivity hypothesis is really the main hypothesis that we'll talk about. We'll talk about both overconnectivity and underconnectivity and how that relates to autism. But first, we're going to start by talking about the neurobiology of autism and specifically some of the risks that may lead to autism. So the biggest risks we have are prenatal risks that may lead to autism. So we have many possible interpretations of these prenatal risks, many of which suggest some sort of epigenetic mechanisms relating to both biological and psychological stresses. And we'll talk about some of these specific risks as we go through. So some of the first prenatal risks, we've got the prenatal exposure to valproate. This is an anti-epileptic drug. Also exposure to thalidomide and misoprostol. So these are all drugs that the mother may be taking for a different reason. So we got an anti-epileptic, anti-emetic, and then this one is an abortifacient, so to help with abortions. But if it didn't work, then you may still be pregnant, have the child, but that would increase the risk that the child may develop some sort of neurodevelopmental disorder, including autism. Also, if the mother experiences gestational diabetes or gestational bleeding, being part of a multiple birth, so twins, triplets, etc., increase the risk of one or multiple of those children having autism. Born first compared with third or after, being the firstborn increases the risk of autism, and even though there is an increased risk of children being born after a sibling with autism also having autism, those being born third, fourth, etc., are less likely to have autism as the first or second born. Maternal or paternal immigration also increases that risk because we see a marked increase in male children being born in urban areas after some sort of immigration. This maternal-paternal immigration is also correlated with nutrition of the parents, poor nutrition leading to these neurodevelopmental issues that can show up in offspring. And then we've got folic acid is labeled. You'll see there's an asterisk next to it. That's because there's a debate on folic acid as either an increased or decreased risk of autism. So a lot of early reports suggested that folic acid supplementation after conception increased the risk of ASD. But some recent studies showed that folic acid supplementation at the time of conception may actually decrease the risk of ASD. So we still need more information on that. And if you don't have any other risks, don't take folic acid. Just don't. It's really those that have some sort of other pre-exposing risk that would be included in these studies that maybe they want to take folic acid to decrease that risk. But again, we're unsure what exactly is going on with folic acid. There's also some perinatal risks. So prenatal is before birth, perinatal is during birth. So prematurity, those individuals born early tend to have an increased risk of developing autism. Some sort of abnormal presentation, so for example, a breech, so feet first, again, has a higher risk factor. A cesarean section, so a C-section, again, this one is a debated risk. The debate ranges as an independent risk factor, as many data sets are confounded by the fact that a breech presentation is both a risk for autism and a common cause for cesarean. So was it a cesarean section because of a breech and that's what increased the risk? Or was it the cesarean section itself that increased the risk? So we have to look at those that had a cesarean section not because of some sort of abnormal presentation or some other perinatal event that caused us to have to do a cesarean section. And some studies that actually are controlling for breech presentations are showing that a C-section does not significantly increase the risk of autism. So if you're just choosing to have a C-section for just because that's what you want to do, then the current research is suggesting that that's not increasing the risk. There are other than perinatal risks that just fall under neonatal hypoxia. So umbilical cord complications if it's wrapped around the neck. Some if you're small for your gestational age, which would also correlate with a low birth weight. Some sort of fetal distress. Again, that could lead to the need for a cesarean section. Some sort of injury or trauma, etc. We do see one here, summer births. We do see a very small increase in the numbers of autism diagnoses for those born in summer months versus other months. Why is that? We're still unsure, but that is something we have found. It does have a significant. There is a significant correlation there, but again, it's a correlation, not a causation. So there's other ones here that you can read. So there are more developmental risks. So neonatal risks would be exposure to air pollution. Residential proximity to freeways in California tends to increase the risk. The highest air pollution levels in the homes versus low air pollution levels in homes, we see that those with higher air pollution in homes have an increased risk. Prenatal or postnatal depression, or that's correlated with antidepressant use during pregnancy, it may increase the risk. Some sort of early social deprivation. So perhaps we'll see something because of COVID. There's a chance that we'll see an increase in autistic diagnoses because many of the babies being born these last 2 years aren't able to go to daycare. They aren't able to go to, mommy and me classes, that kind of thing. Also some severe sensory deprivation, so congenital blindness, hearing impairment, or vision and hearing impairments. Talking about this prenatal or postnatal depression, then we see that speech and language disorders, then we see that there is a increased risk with SSRI uses, so it's not just for autism, it's other neurodevelopmental disorders as well. We see an increased risk. So antidepressant risk may be confounded by the fact that many cases of prenatal depression are undiagnosed, and so the antidepressant treatment group risk may be due to depression, not the antidepressants. And again, this early social deprivation risk comes from studies of children born to institutionalized mothers in Romania. And it's possibly confounded by other factors, as many of the cases of ASD diagnosed in early development were resolved at later periods, and low rates of intellectual disabilities were reported. There's support for some of these, but then you've also got to question some of them. On convergent mechanisms, then we do see that there's individual risk factors that may result from common underlying causes. So epigenetics, parental age, immigration, delivery complications, and then some sort of stress. So again, immigration and depression would put stress on the parents, which puts stress on the fetus, and then delivery complications. And then hypoxia or immune activation, pre or perinatal, also increase these risks. So we're going to stop here for this video, and in the next video, which will be posted on Wednesday the 27th, then we will continue talking about the neurobiology of autism, and then we'll get into that connectivity hypothesis.